Prescription drug use began to go up in the early 1990s, reached current levels by the early part of the 21st century, and continues at those high levels today. So where the correlation comes into play is individuals who begin their use of narcotics through prescription use, which is far more common than heroin use.
Prescription drug overdoses are outstripping automobile accidents as a cause of death. So we have a huge problem out there. It's primarily led by the opioid prescription drugs, but we also have a lot of concern about some of the benzodiazepines and some concern about the stimulants as well.
People are becoming addicted to prescription pain relievers. Then they don't have a doctor to prescribe them for them anymore, or they run out of them.
As people that become addicted to prescription drugs are unable to find them or afford them because the prescribing measures have changed, we're putting in safeguards to prevent people from getting inappropriate prescriptions, the price goes up on the street, then people transition over to heroin.
It's a lot cheaper to find heroin on Long Island than it is to buy these prescription drugs from somebody trying to sell them on the street.
Well, the major problem is twofold. Number one, we do not train physicians well in the etiology of pain and in the management of pain, the appropriate chronic management of pain. As a result, there is an overprescribing of narcotic pain medications.
Doctors often find themselves with the dilemma of addressing a patient who's in their office who has complaints that appear legitimate and genuine, and they're trained to respond to people's reports and to do something to treat, if they can't solve their problem for them, they help alleviate their suffering. So they're doing many things out of compassion.
At the same time, we recognize that pain is a very real problem and it has to be addressed. So I think that goes back to our training as physicians.
Physicians have been well trained to respond to pain as a symptom and recognize that treating pain effectively helps people who have acute problems recover more quickly and people with chronic problems remain more functional and have better life satisfaction. Unfortunately, I think what has not gone along with that is doctors have not been trained to recognize substance misuse and addiction and have no idea how to manage those types of situations. So there's an overemphasis with a good benefit for treating pain, there's an underemphasis on recognizing that along with the benefits of pain medication, there are significant costs involved.
So as we put down the safeguards to prevent prescription opioids from being misprescribed or taken inappropriately, we really need to put down treatment as well. We need to have more treatment available.
Now, folks in the treatment community have known about this problem for a long time. In fact, it was good evidence that beginning in the early 1990s and reaching current levels by around 2002, prescription narcotic use had gone up enormously in this country.
In addition to that, the disease of addiction has both a genetic and an environmental component. And when the environment is inviting, such as what happens with the medicine chest, you expect to see an increase, and that's what we're seeing.
The federal government does surveys, national household surveys of drug use, and what they found is that the majority of people reporting misuse of prescription medications actually obtain those medications from their own medicine cabinet or the medicine cabinet of a friend of the family member. So an important step to reducing the availability of these drugs would be for people to appropriately dispose of unused prescriptions as quickly as possible. The Suffolk County Police Department has recently begun a program where they will collect unused prescriptions, no questions asked, at the local precinct station.
I don't think there are very many Americans who throw away the extra pill that they may have left over from a prescription, even if it's an antibiotic. I mean, we just, as a class of people, just don't want to waste anything. So if you open up anybody's medicine chest, my own included, you'll find that there are prescriptions that are no longer necessary for you to have there. And in fact, we do have a program out here in Long Island of give-backs where the police stations will actually take the medications, no questions asked, and throw them into a bin, and then, through the proper channels, they get destroyed.
Nationally, we have been seeing a continued increase of people being admitted to treatment for opiate misuse. There has been about a 345% increase, I believe, over the last decade or so. We're seeing it among youth here in Long Island and nationally.
Federal studies indicate roughly 14 out of every 100 graduating high school seniors has tried a prescription narcotic before they graduate high school. So that makes it fairly common. Much lower levels have tried heroin. But somebody who begins to use prescription drugs and it becomes a problem for them may find themselves turning to heroin as a readily available and initially less expensive, because it's a more potent drug, solution to their problem than continuing to find prescription narcotics. But eventually, use of heroin has its own unique set of circumstances that make it more difficult.
Now, heroin is very hard to control because you have no idea what you're getting on the street. You have no idea what it might be cut with. The levels may vary a lot, and it gets into a whole nother level of contact with other sorts of people on the street.
So heroin becomes a bigger problem. Not only that, heroin isn't government regulated. You don't know exactly what the dosage you're going to administer to yourself is, so it becomes a big problem with overdosing.
Parents are the anti-drug. I agree with that. Commercial, 100%. There's no question that the forebrain, a part of the brain in youngsters, is not well developed, and it's one of the areas where exposure to drugs will actually change the structure of the forebrain and make them more prone to addiction.
The greatest tool for prevention purposes is to, and it's a cliche almost, is to have an open and honest relationship with your children.
Overall, I think that teenagers, young teenagers, older ones, need really straight information about what's going on.
Parents who are on guard about that discuss it with their children legitimately and logically, not from a fear standpoint. But I think that kind of open dialogue is what we need more of in order to prevent some of the addiction we see.
So I think telling the truth is really the most important part of it.